I want to thank everybody for coming today for this exciting announcement. Out of your busy day schedule, really appreciate it, and we're excited about this. So I would like to introduce Don Hay.
I had a tour of the 3 hospitals a while back, and the one spot they stopped at in here was the MRI clinic in the basement here, but we didn't really have too much of a chance to see it because it was basically in use, and they were telling how they've got lots of patients, and when I'm sort of talking to them a little bit more, I found out they've got lots of experienced staff that know how to use the machinery and know how to read the results from the machinery, or the MRI, but they don't have a second one to help to alleviate the problem. And I started thinking that would be the best way to help when talking to some people. If we get you started talking about a second MRI, so a donation toward that. And I'm going to be giving $10,000 a year for the next 5 years. And $50,000. It is a great thing to be able to see some of the results, and the people that are pleased by it will be able to be helped by the MRI. And some people say, like, doctors don't get the total credit. If they have to all they have to do is read the thank you notes in the newspaper, and that tells the doctors, about the staff, how good a job they did, sometimes way later than the operations. But the MRI seemed very important because they sort of, by talking to them and listening to what they were saying about it, it was so great, a great use to everyone. So I'm proud to be able to donate toward that. Thank you very much.
So I've known Don for a long time. He was actually a student of mine many years ago, and we've stayed in touch over the years, especially through the hospitals and through the work that University Hospitals Kingston Foundation has done. And I bump into Don at lots of volunteer functions, and he's a great volunteer for us. He attends the Bell luncheons that help inform donors about how their money is being spent to better the health outcomes in the 3 Kingston hospitals. And there have been some really interesting presentations there. We also have the bus tours that are open to people to tour around the various hospitals, and I'm pleased to hear that the result of that was a $50,000 donation from Don. The MRIs are incredibly important to our whole region, and I think that's very important for everybody to understand, that we serve Kingston, but we also serve an area from Brighton to Cardinal and up north to include Perth and Smith Falls. We are the regional tertiary care center, and people come here from all over this area to be well served by our hospitals. And we are supported by people and by municipalities throughout the whole area, and including the regional Lions clubs. The Kingston Lions Club has made a huge donation to this cause, this particular MRI, and they're holding a golf event this weekend to raise money, and all of that, the proceeds will go towards the MRI. So it's a very expensive undertaking. I think it's about a $6 million, that round numbers, $6 million project. And so it takes a lot of donations to make that. Don's generosity is a real leadership gift, and the hospital, KGH, is recognizing that leadership gift, Don. The board of directors of KGH has approved the naming of an outpatient treatment room in the Cancer Center for 10 years in recognition of your gift. So that's a nice recognition by the Hospital. So we thank you very much for your gift. And Don, it's a delight. Really, really wonderful. Thank you.
Thank you so much. And I am here with the people. Zoe Mackenzie is the senior in MR. Jennifer Fraser at the end, she's one of the MRI technologists, and in the middle is Dr. Fitton, one of the radiologists here at the hospital. They can attest more than anybody in having to deal with such a large volume of patients that we cannot accommodate with one MRI in a single day. So now with having, in the future, with the 2 MRs, I mean, this is such a huge step forward, and contributions like yours are the only way we're going to be able to do it that'll make a difference in all the patients' lives that we face every day. And as Ian mentioned, it is such a wide, everybody that KGH serves comes through imaging and so much directed to MR and all the specialties. So it is such a huge need in our department for us, and like I said, these staff members deal with it every day, having to prioritize who can access that service today, and we know, we're frustrated with the delay and trying to get everybody in timely. So thank you so much. It's going to make such a difference.
When we had the tour, we got to hold the tour off from going in there because
we had a patient. We did have somebody we had to get in right at that time.
We couldn't. You can't really see it now, but
Yes, right. Yes.
That's correct. Thanks.